The following video contains scenes that may be disturbing to some viewers. Viewer discretion is advised.
What if we lived as though we were dying? Would that force us to live more authentically, fearlessly even? Tomorrow has no guarantees. Yet despite life's transience, most of us will live as though there is one. That is, until something happens to change our perspective. Beliefs on health and wellness are universal. The Substance Abuse and Mental Health Services Administration cites 8 criteria for wellness. In numerology, the number 8 is significant because it balances the material and spiritual worlds. In fact, beliefs on this number's mysticism can be found across almost every major religion. And over the course of several months, I discovered its palpable significance as I investigated the culture of organ donations in Canada and came to learn that one organ donor can save up to 8 lives. I'm meeting with Jason Rumball, the man you first saw hooked up to a dialysis machine.
Hey, Nadia.
Hi, Jason. How are you?
Doing good. How are you? Come on in.
He's a former donor recipient, but now he finds himself on the transplant list yet again. I want to understand what his experience has been like within the donor system. But first, I need to find out what led to this devastating prognosis. What led to that prognosis?
I guess you could say when I was born, because I was born with a condition known as spina bifida.
Spina bifida is the most common permanently disabling birth defect. It happens when the spinal cord doesn't close in the early stages of fetal development. This causes damage to the spinal cord and nervous system. Jason was born with nerve damage at the lower sacral region of the spine. This has affected his legs, bladder, and bowel function.
You can't empty your bladder properly, so you have to use a catheter. Over 21 years, the kidney slowly started to deteriorate. Got to the point where I needed to be on kidney dialysis.
Around 70% of spina bifida patients take medication to control their bladder function. But it's not exactly effective. 30% of the patients don't respond to the drug therapy, which leads to long-term strain on the kidneys. Years of silent kidney damage would lead Jason to reveal a shocking discovery, made not by his doctors, but during a routine eye checkup.
From the eye exam, the doctor noticed that I was getting blurriness in my eye, that I was bleeding in my eye, so he said, "You got to go to the hospital right away." My blood pressure was very high. It was quite extreme, 220 over 130. It was
Wow.
very critical.
According to the Canadian Patient Safety Institute, medical errors lead to 28,000 deaths a year. But in speaking to Jason, it's clear he has an unwavering resolve. He shares that growing up with spina bifida forced him to face these challenges head on.
I was in the minority in a lot of ways, and some of the students were, accepting of, making me feel welcome at the new school, but then there was others that, weren't so nice. It was, tough to, lose my dad at such a young age. I wish I were able to, to have him there during my teenage years. My mom, was there. She took on the role of both, mom and dad. My sister and I were quite close as well, so she's like a second mom to me.
Jason was about to face even more challenges as a young man as he reveals some of his darkest moments in his prognosis.
Was diagnosed November 21st, 1997 with kidney failure. That's when he found out. And then immediately after that, I had surgery in December of 97 for the dialysis.
It would be 4 years of weekly hospital sessions, hours hooked up to a dialysis machine. And that support system he so genuinely spoke of would prove to be a matter of life and death. Before we find out more about Jason's journey to receiving the first gift of life that saved him, I set out to learn more about the provincial donation process. 1,600 Canadians are added to the wait list each year. 40% die while waiting. While 90% of Canadians support organ donations, only 23% are registered donors. Canada is the only Western country in the world that does not have a national donor registry. I think it's important to speak with a frontline healthcare worker. That's where Dr. Andrew Healy comes in. He's worked in some of the busiest ICUs in the country. He's also the Chief Medical Officer for Trillium Gift of Life Network. Trillium's strategic initiatives has been to increase donation consent. Can you speak to that a little bit more and explain how that works and how that could be a potential barrier?
That work involves building a culture within the critical care units where potential donors exist. We own some of the responsibility to ensure we set that family up for making a successful decision that they will not regret in a month's time. So I'm actually okay if a family says no, if that's what they want. But I think it's really important to understand that lots of times they get to know because of the journey they've taken, something we've done along that process, a support that we haven't been able to provide, or the way in which we approach that question. So I think our objective at TGLN is to make sure that we don't have barriers in that conversation.
Part of those barriers has to do with the fact that doctors are not trained donor specialists. They are working with an external specialist who deals separately with donations. Just look at the facts. There are currently over 1,500 Ontarians on the transplant list. And given the COVID-19 pandemic, that number will continue to grow. So it was time to get down to the nitty-gritty and understand how the donor process works more specifically.
So there are really two pathways to donation, organ donation in Ontario. The first is after a catastrophic brain injury. Those people go on to be determined to be dead, but their heart is still beating. So people call that heart beating donation or a donation after brain death. They are still on a breathing machine and they have supports in place, and they have the opportunity to donate after the determination of death.
In 2003, the Canadian Council for Donation and Transplantation determined the standard for neurological determination of death. Diagnosing neurological death requires the determination of the following criteria: the irreversible loss of brainstem reflexes, absence of pupillary response to light, A lack of movement or response to pain, the inability to breathe without mechanical ventilation, the capacity for consciousness is lost. And I asked that TGLN set me up with a donor family whose loved one met those very criteria.
He always comes to this picture.
I sat down with Samit Khanna and his father Jaydev at their family home in Mississauga, Ontario, to talk about how they turned tragedy into the gift of life. In 2018, Rama Khanna, who was a well-known family physician in Georgetown, suddenly passed away.
We got to the hospital, we got to the emergency. My sister, my dad, and I were there at that time, and I could see that they were trying different things to revive her or to get her back to consciousness, and it wasn't working. The emerge doctor came out and talked to us, and he said, "Hey, your mother is very sick." And I said, "Okay, like, break this down. A scale of 1 to 10, 10 being death, where are we at?" And he goes, 10. And I remember him telling my dad that her brain is in parts of her skull that it shouldn't be in.
The prognosis was cut and dry, leaving no room for hope, but only action.
The hospital said, "Hey, tomorrow morning someone's going to come, and they're a representative from the Trillium Gift of Life, and they'll just educate you on organ donation." So it was just suggested to us. And then the coordinator at the Credit Valley Hospital from Trillium Gift of Life, they came and they talked to us. And then they allowed us to discuss it as a family.
Were you a family that spoke about organ donations prior to?
No, not at all.
The Khannas, who are part of a South Asian community, tell me that the misconceptions surrounding the act of donation are common. As a result, Ontario's South Asian community has one of the lowest donor rates in the country. Samit and his family consulted with Rama's extended family in India, almost to get the green light to go ahead with their plans for donation. And once they got their family's blessings, things progressed quickly.
They told us, that they'll take her off life support. They'll make sure she's passed, she's comfortable when she's passing. But when she passes away, they will we have to say our goodbyes beforehand, because they will want to rush her out of the ICU into surgery, because they want to harvest the organs as soon as possible.
Is once you take the organ out of the body, how can you optimize that organ for transplant in a way that limits the injury? And because every organ is injured in some way as they're taken from the body and have a period of no blood flow or nutrient supply before they're transplanted. And so Ontario also leads that in many ways. At the Toronto General, they have an ex vivo lung perfusion device, which is where you take the lung from the donor and place it on a breathing machine, have it perfused with fluid. You can treat that lung, you can look at the lung, you can x-ray the lung, you can use a camera to look inside the lung and optimize that lung in many ways. You can treat the lung for infection, and you can improve the function of many lungs in that way.
She was gone. She was brain dead, she was gone. And if we could benefit someone else that's sick, that's her legacy. That's how you honor a person who's practiced medicine and helped sick people for her entire life. Is her last act on earth is to help a sick person. And we think that she would want to do that.
Living part of our loved one is still alive, and it is still alive in the body of someone else,
It became clear that the gift of life became a source of strength for the Khannas. Earlier, I spoke about Jason's family support being a matter of life and death. Well, you'll come to learn just how close to home the gift of life was for Jason, as I was joined by his sister Rochelle, who shares how seeing her brother deteriorate so quickly was almost a call to action.
As a family, we all knew He needed a kidney. It likely would have been best coming from a family member. And our dad passed away when I was 15, so Jason might have been 11. So there really was my mom and I.
But given Joanne's poor health and age, she wasn't exactly the best donor candidate for her son, leaving Rochelle with a difficult decision.
I didn't decide right away. It didn't come like that. I don't know the exact day. Jason probably does because he's so good with dates and
It's on my birthday.
It was your birthday that I told you. See, I knew you'd remember. Don't cry on me.
How'd you tell Jason?
Again, he would remember. He's.
We were
Sure that was it?
we were in the kitchen. We it was on my 23rd birthday. We're taking a break from the birthday celebrations. Yeah, that's when Rochelle told me.
There's no greater gift.
No.
But deciding to be a donor for her brother wasn't going to be an easy journey. Rochelle made dozens of hospital visits to determine her physical and emotional viability as a donor candidate. As luck would have it, the medical team at St. Mike's declared her a perfect match for Jason, and things progressed quickly.
If I told you in November and it happened in January.
It happened quite quick, yeah.
Wow. It was quick. It was pretty quick.
Oh, yeah.
But as I came to learn, a kidney transplant wasn't exactly a quick fix. I reached out to Dr. Lori West, who's one of the country's leading transplant immunobiologists. That's essentially an area that deals with the aftercare of transplantation. She was able to connect with me via Skype from her home office in Alberta. So transplant isn't a cure. I think that's something that people probably think it is.
It's not a cure. It's an exchange of problems that are no longer manageable for problems that our patients who have a transplant have to stay on immunosuppressive medications for the rest of their lives. And those create all kinds of other issues. More like having a chronic disease. Once you're a transplant patient, you're always a transplant patient. And if you're getting a kidney transplant and the drug that you're using to prevent rejection invariably causes some kidney damage, you can see the precarious balance then.
We're shortly thereafter joined by her colleague, Dr. David Hartel.
The biggest challenge is actually the medical system itself. And you have a greater chance right now of needing an organ than of ever donating an organ in your lifetime.
Dr. Hartel tells me that the transplant list itself is an arbitrary number because it doesn't necessarily count all the people who are in need of a transplant. Physicians will only put on patients who they feel have an actual chance at getting a transplant. That means they don't list the patients who are too sick to wait, even if they might be able to get a transplant as soon as possible. The transplant list number also doesn't include the people who were waiting on the list whose health had declined so badly they were removed from it. So what could we be doing better? Well, we could start by understanding how many donors we could have had in Canada by looking at how many donors we're missing per year. The pool of potential donors is quite limited. For one, you must die in an intensive care unit. You can't have any type of cancer or infectious disease either.
Both of those cases will be cases where the family decides to withdraw life-sustaining therapy. It's a very narrow set of patients that meet the medical criteria.
Walk me through the medications that you have to take on a daily basis.
Sure, I could do that for you. So we got quite a number of medications here that I've had to take, since I got the kidney transplant.
So these are immune suppressants?
Immune suppressants. Okay. It takes some time to get used to this one.
So while you're taking it to sustain yourself, it's also taking a toll on your immune system.
Right,
as well,
exactly.
Right?
Yeah.
How many pills in total are they in your box?
So we got one. So we got one here, and then 2 of these blood pressure, 1 of these prednisone, this one here, 4, 5, 6. Yep, we're still going here.
A visibly breathless Jason walked me through around a dozen more different medications he takes to prevent his body from rejecting his kidney. It's almost ironic, isn't it? Like Dr. West said, immunosuppressant medications invariably cause the same type of damage that leads to a transplant in the first place. So what I fail to understand is why patients like Jason aren't prioritized for donations.
Kidney doctors, the lung doctors, the heart doctors, the liver doctors, and those people know the degree of urgency of each person that's on their list, and then they know how sick they are. We have to understand that in Canada, deaths on the waiting list are common. And I think that we can strive to reduce those, but those will never go away.
So it's clear there's still a lot of work to be done. Like Dr. Andrew Healy explained, agencies like TGLN are working hard to close the loopholes. But frankly, for most Canadians on the transplant list, they aren't exactly gaining from those strides. I was curious to learn more, to talk to people who had either been on the list or were trying to take matters into their own hands. And that's how I met James Beckenridge. Him and his wife Elise co-founded the Canadian Transplant Society. They're listed as a Canadian charity that essentially operates a mobile kiosk, offering information on the donation process.
There's a lot of people out there that are on the edge of becoming an organ donor and they want to go and pick up the phone. And if they go and pick up the phone and there's nobody to call at Trillium, or they have trouble getting through, or they can't get an answer, then we're here to support that void that is so desperately needed to get these people to become organ donors. There's no reason for Canadians to be out there dying. The only reason they're out there dying is because we don't have enough support in this country for organ donation.
Let's go back to what motivated you to start this. Your wife was diagnosed with end-stage liver failure.
That's correct. In 2008, took her into the hospital in August, and by September, she started failing. And by the middle of September, her kidneys failed. She got jaundice so bad she was yellow, purple, green, and every shade under the rainbow. She had all kinds of paraphernalia and equipment attached to her to keep her alive. And a full-time 24/7 nurse sitting right beside her.
So she was essentially dying.
She was dying. I thought, my goodness, there's all these people passing away with great organs that are going to destroy them. They're either going to cremate them or they're going to put them in the ground where they're going to rot. And here is my wife just needing a liver that would save her life. Luckily, the Friday night at 4 in the morning, Saturday morning, there was a motorcycle accident. Not lucky for the motorcycle driver, but lucky for us that he was a donor. The liver wasn't going to last because it was so badly damaged, and there wasn't any other liver out there.
I mean, not only did you receive one transplant, you received two. That's rare. And you come out on the other side.
I was hoping and praying, as were many of my friends and family, praying that I would get a transplant liver.
Hear that you have end-stage liver failure. What goes on in your mind at that time?
I'm telling the doctors I thought that the system they had was pointless and useless. Because, okay, on the other hand, it worked for me. But I don't think people should have to wait so long to be so sick and desperate and praying for their lives when there's so many more people that pass away that could give their organ. If one person died, 8 of us were going to survive. And 57 other people, more now, we're going to benefit from this one person passing away and giving the gift.
That gift, and that phrase becoming more and more relevant. But just what will it take for most Canadians to receive that gift? In 2020, 280 Canadians died while waiting for an organ transplant. So let's take a moment to break things down. So far, we've looked at donation after brain death. Now, we need to look at the other form of donations in Canada, and that would be non-heart-beating donation. I'd like to revisit Dr. Healy's explanation on what that is and the logistics surrounding that form of donations.
Sometimes a catastrophic brain injury or other illness will be present, and either the patient themselves or the family, on behalf of the patient, make a decision that they wouldn't want to continue aggressive measures to save their life, and that they want to take a palliative approach, an approach where we relieve suffering.
At that point, life support is withdrawn, and the patient is rushed into the intensive care unit to proceed with non-heart-beating donation. But let's face it, this type of donation is not exactly common practice because doctors are often reluctant due to ethical concerns. And while non-heart-beating donation is a contentious form of organ transplantation, it's important that we at least understood the other practice of donations in our country. I was back to visit Jason. At a late-night taping of his radio show, I could see the effects that dialysis was having on his health.
Happy Saturday, everyone. This is Lil J, and welcome to another edition of the Block Party, coming to you live from the Whistle FM studio here in Stouffville, Ontario. And we have a great show for you. Let's try that again.
I left that night feeling extremely sad, disappointed, confused even, wondering what our government is doing for people like Jason who are on the transplant list. Around the same time, I remember reading about Nova Scotia's groundbreaking and controversial legislation, Bill 133. At the time, Stephen McNeil was Premier, and I reached out to his office hoping to understand his motivations for creating something that was quite unprecedented in the country.
So many Nova Scotians wanted to be organ donors, yet we had so many who were not, in the end, having their wishes fulfilled, or that our lists were growing.
Right.
So as part of the presumed consent, we've also invested a lot of money in ensuring that we're providing the training to healthcare providers in our rural hospitals, so that if something were to happen tragically to an organ donor in other parts of the province, that we could then take the necessary steps to ensure that that organ remains healthy as that person's wishes are being fulfilled. Every time you renew your card, you'll be asked the question, you are an automatic organ donor, do you want to opt out? So that will start the conversations at home.
The truth is that Jason doesn't have the luxury of time. I visited Jason at the kidney clinic at Mackenzie Health to see how he was doing, because frankly, without the dialysis machine, he'd have at most a week to live.
The nurse will come and see what the issue is.
The issue is the blood working.
Yeah. Okay. Okay, great. Hopefully that works. Like this red one takes the blood out of my system, like the toxic blood. So that goes through goes through a filter over there called the dialyzer, and that removes all the excess toxins and goes through the cycle. And then this blue one here, this returns the blood back to the body. So after it's cleaned, it's returned back to the body and just goes through a continuous cycle. Say if they book the surgery tomorrow, this could be my last session here today. So I could be off dialysis right away.
In getting the opportunity to speak with various families affected by organ donations, it's clear that while the system of donations is deeply flawed in our country, in large part because of the circumstance at which death occurs, that the gift of life is immeasurable.
I got to go to my daughter's wedding. I never would have gone to my daughter's wedding. This was a huge deal for me. I love my son-in-law, we both do. And it was a wonderful occasion, and I wouldn't want to miss that for the world.
You know, there were moments where we would actually think about the other person and hope for them, pray for them, and hope that they were doing well and the lungs that they had received were working out for them. So it kind of, you know, breaks that grief that you're in.
The person's organ is still making somebody live a better quality of life. And so what can be a better thought than that? It's actually a kind of a living memoir.
It's pretty cool that my kidney is,
No, it's awesome.
is in him. I'm
Yeah.
so glad it lasted as long as it did. We're sort of, it's all we have. We have each other.
Right.
Things are much different now as we battle a global pandemic, but let us not forget the daily battles of those in need of transplants, those like Jason Rumball, who would do anything for a little extra time.
One organ donor can save 8 lives. And for me, I can imagine the possibilities are endless for me if I were to receive a kidney right now. I think the one word to put it all together is freedom. Freedom to live my life. Freedom is definitely what this would mean for me.
For more information on how you can become an organ donor, visit badonor.ca.